Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Today I'm going to talk to you a little bit about how to stop taking the medication Omeprazole. Omeprazole is a proton pump inhibitor. What does that mean? It reduces stomach acid. Reduces stomach acid secretion. It's available in the U.S. under the brand name Prilosec. It's available generically, and by far most of the sales occur with the generic. The OTC or over-the-counter form is indicated for 2 weeks or less, is how long you're supposed to use that. Prescription insert tells you it should be used for 4 to 8 weeks. Oftentimes we see it used for much longer than that, and then it makes it difficult to quit after your body's used to this medication. Some of the common uses, just to have a full background here of Omeprazole, again, I want to emphasize that the literature suggests we should use it for the shortest time possible, 2 to 4 weeks. GERD, or gastroesophageal reflux disease, may take 8 weeks of treatment. Ulcer treatment, 1 or 2 months. H. pylori, that's an infection in the stomach. You usually take proton pump inhibitors along with typically a couple antibiotics like amoxicillin, clarithromycin, something like that for 2 weeks. Prevention. When you're using it for prevention, like if you're taking certain medications or if you have certain conditions that require you have hyper secretion of acid, you may need to take these long term. These medications can help prevent serious conditions from occurring. However, if you're only taking it for a short term use, sometimes you get stuck on these and you really don't need to be taking them long term. Erosive esophagitis, that's one of those long-term conditions where you may need to use it for years. NSAID protection, that's where you're taking like ibuprofen, naproxen, diclofenac, Totolac, something like that, and you're going to take the omeprazole to help protect your stomach. And again, that's one of those situations where you're simply going to have to use this long term, especially if you're at higher risk of a bleeding ulcer. So there simply are situations where that long-term therapy is going to be needed. So what are some of the long-term risks that seem to be associated with omeprazole? Well, it seems like it may increase the risk of fracture, so weakening bones over time. And again, this is when you're on it long-term. We're talking years and years here. Increased risk of certain kind of infections like pneumonia or a serious colon infection called C. diff. It seems like it may cause low levels of magnesium in the body. Because stomach acid is important. It's there for a reason, and it helps with the absorption of certain vitamins and things, the proper breakdown of food so that your body can fully utilize them. So it seems like magnesium, vitamin B12 is not absorbed properly, and iron and calcium seem to need that acidic environment of the stomach, and when we take that away through prescription therapy or over-the-counter therapy, you just can't optimize the levels of those in your body. So how does one wean themselves off omeprazole? Because it's hard to stop. If you're on omeprazole and you've tried to stop, it's been shown acid rebound can occur. That means your acid production could come back even more than it was before you started on this. But you can mitigate this. It is something you can do. So if you're on the prescription 40s, you'd want to go to the 20s. And again, if you're taking the prescription form of omeprazole, you'd want to talk to your physician or your healthcare provider. Explain to them you want to go off this medication, and they'll help you to determine whether you have a long-term risk where you're better off taking this, or if it is a good idea to try and get you off of this. Then, once you're down to the 20s, typically you're going to try to go every other day with this medicine. And if you can, if symptoms are too bad on that day you're not taking it, you can take an H2 blocker or antacids on the alternate day. So you would do omeprazole one day and an H2 blocker like ranitidine or famotidine the next day, omeprazole, and so on. And then after a few weeks, you can go to every third day. You can omeprazole, ranitidine, omeprazole, and continue to slowly wean yourself off of that so that hyperacidity is not so terrible, something that you can live with. Okay, and then once you're to every third day, you can try switching entirely to an H2 blocker. Like I said, that's ranitidine or famotidine are some of the most common ones that we see folks use. And the interesting thing, H2 blockers, H2 means the histamine 2 receptor. Actually, it may work better for certain nighttime symptoms, certain nighttime acid symptoms, because sometimes histamine is involved with that. So that's something kind of interesting to keep in mind. You slowly want to decrease the dose of then your H2 blocker to every other day using antacids. Antacids, we're talking about Tums. We're talking those little chalky tablets, Rolaids, those chewable antacids immediately neutralize the acid in the stomach. And then we're going to, do the same sort of thing every third day. And then we really want to try and stop that. Once we're stopped and off of it, we can keep antacids on hand for flare-ups. And if you're just not able to stop or your symptoms are terrible, you want to follow up with your doctor. Make sure there's no long-term condition there, something more serious going on, just to be evaluated. So lifestyle changes. We want to stay off of this. Once you get yourself off, you want to keep yourself off of it. Weight loss is a big one. I know everybody groans when I mention that, but that's how I got rid of my heartburn. I hated to admit it, but I needed to lose about 15 pounds. And once I did, my acid stomach went away. My heartburn disappeared. So I know it's easy to take a pill, but at the same time, you feel better when you lose that weight, and it's nice not to be dependent on a medication. Avoid eating a couple hours, 2 to 3 hours before bedtime. That just having that food in the stomach and then you lay down can kind of push on the esophagus and come up to bite you when you're trying to go to sleep. So stop smoking. Again, one of those hard ones, but man, you can really free yourself from a lot of health conditions and symptoms when you break free from that habit. That's another one I know that's hard to break, but man, when I finally kicked it, what a feeling. Stress management. Life is stressful. We're busy, we got jobs, we got kids, we got bills. It's all stressful, so we need to try and manage that. And, one of the big things is watching what we eat. It's easy to just grab some garbage and shove it down your throat. And you don't feel good afterwards. You get a momentary enjoyment out of that snack food. But in the long run, it makes you feel worse. So just try to make a few better decisions in your choice of food throughout the day. Learn some simple breathing techniques. There's a lot of real easy apps out there. Simple box breathing. Maybe take a yoga class. Whatever. Just a few minutes of calm, man, can do a lot for you. Quality sleep related to that stress. If we get some good sleep, not only we're going to make better food choices during the day. It's been shown we're going to be more likely to exercise, and it also less acid problems. So you owe it to yourself. You owe it to yourself to get some good sleep and feed yourself well so you feel good. A lot of this can be managed. I know it's hard. It's the easy choice. But in the long run, you're going to do yourself a favor if you really think about some of these lifestyle things. Elevating your bed 6 inches off the floor, the head of the bed, can help, because then it's less likely to come back up the esophagus. And if you do need to use over-the-counter Omperzol, no more than 14 days, just like the label says. Even though it comes in a box with enough there for 3 weeks, if you read the label, it says you should use it for no more than 14 days. Try and stick to that, and then you won't have such a hard time getting off of this medication. Alright, I appreciate you watching my video. I hope the information was useful to you. Again, if you have chronic symptoms, talk to your healthcare provider. We want to make sure there's nothing serious going on, no sort of problems with your esophagus or ulcers or other stomach issues. And I'd really appreciate it if you subscribe to my channel. And thanks again for watching.